So I think we should pay attention and see how we can improve some of these things which we are doing every day in our healthcare. So I think the organizations have taken a real pain and efforts and have organized, and so each one of you should benefit. So those people who are taking coffee and all should be assured in it. All right, people are coming in, and so I'll take a couple of minutes. We have only two panels, and Grace Matari and we are co-chairing, and very nice to have them. We were talking about the subject here is power of we. Building collaborative and complementing healthcare ecosystem. I think I will start with an incident when about 3-4 decades ago when I was in the UK. I went there and it was my first or second week, and one of my friends said that, can you take a duty for me? Probably all my nurses coming from KIMS might have heard this story many times. And so I went there and I had a beeper, and I took the duty for one of my friends who had to go to the airport to collect his parents. And then my beeper went on, and then I went to the ward, and someone said, this is the patient, so I went and started talking to the patient. And the nursing supervisor of the ward came to me and said, are you on duty? And I said, no, I'm not on duty, but I'm covering for one of my friends. Yeah, so you are not on duty and you are covering for someone. You should have told us before you go and touch the patient. And that's the nursing supervisor said. This is my first 2 weeks in the UK, near Birmingham Road Hospital. So I said, I'm sorry. And she said, that's fine. Go ahead and examine the patient. So that was the power of the nursing at that time for decades or even more ago. So that's what, I always say that the nursing here, I was just telling some of the leaders here, the nursing should grow. They should be empowered, and it is what is we? Power of we were saying. What are we? So the we is yourself, or the we of the healthcare can be myself as a doctor, and you as a nurse, and the manager is the policymaker, or the management is there. So all of us have a power in really establishing healthcare. And so that's what we are going to talk. And already we are a little bit of overtime. And so therefore, I'm not going to go into the details of it, and we will have a few questions to our panelists. And we should be taking some questions from the audience also. And so we should collaborate. You should really, I'm talking to the nursing leaders here. How many of them are in the various committees of your hospitals? How many of them are in the decision making in the board, in the executive committee? In my hospitals, for every committee, every important committee or relevant committee, there will be a nurse, and nursing chief or her designee will be definitely there. So it's high time every hospital should demand that. How many times the doctors came before us today? I was taking rounds in the ICU, medical ICU, and I called the nurse and asked, before I talked to the doctors, there were 4 or 5 doctors around me. I said, give me the details of this patient who was a colleague of mine admitted very seriously in the medical ICU. And she gave a good description, but I know that very rarely happens because the nurses just go along and their contributions are not recognized. So this is, what we have to change. So this can be changed only by the power of we, and for which each one of you should grow, and then only the power of we comes in. I'm closing it with just something which I always love and like. I have a dream to have freedom of the creed and equity for everyone. Can anyone say who said that? I have a dream to have freedom of the creed and equity for everyone. Every man is created equal. Anyone who wants to say who said this? No one? This is Martin Luther King Jr.'s freedom speech in the United States for the blacks. And I'm not comparing, we have freedom, we have our beliefs and equity for everyone. But probably we are not grabbing it enough. So I want to say that I have got a dream that our nursing should show the power of being. Let us go. Let us start.
Good afternoon, my dear colleagues. Thank Dr. Sadullah for setting the tone. It's really my honor to chair this panel, this ANEICON 2025. The theme already have been explained by him. Just to add a few words into that, the power of we underscores a vital truth in healthcare. No single entity can achieve optimal patient outcome alone. It takes a village, or more precisely, the entire ecosystem. A collaborative and complementary healthcare ecosystem refer to a network of stakeholders that all of you will agree with me. The clinician, the patient, the payer, the regulator, technologist, researcher, nurses, and the community. Each one have to work synergetically, each leveraging their unique strength. It's not just about coordination, it's about co-creation where gaps are filled by partnership and silos are broken through mutual goals. It's not only in India, across the globe, we face shared challenges because of the rising chronic disease burden, aging population, workforce shortages, health inequities, and digital disruption. Our opportunities lie in collective intelligence and shared responsibility, moving from an isolated excellence to an integrated impact. Today, our distinguished panelists bring a diverse perspective of this. We will explore what does true collaboration look like in practice and what are the barriers and how do we design systems that don't just cooperate but truly complement each other. As we begin, let's remember, collaboration is not just a strategy, it's a mindset shift. It's about trust, transparency and shared vision. I now invite our panelists to help us unpack this theme with insights from their field. Together, let's explore how we can build ecosystems that are not just connected but cohesive, inclusive and sustainable. First, I invite Mr. Durga Prasad. Could you explain the ways to improve communication and collaboration between different healthcare professionals such as doctors, nurses and allied health professionals? Over to Mr. Durga Prasad.
Yes, good morning, madam, and good morning to all the delegates present here and the dignitaries of the dais. It's a very pertinent discussion topic today. How do we bring about collaboration and synergy among the diverse stakeholders? And all of you agree that healthcare ecosystem is very complex because of the changing regulations and the changing dynamics of the interplay between the various stakeholders that has largely changed with the interface and technological changes that have taken place at a very rapid pace in recent times. So the first point, which is very, very important for all of us, is to understand that all the key stakeholders, from a talent perspective, whether it's clinicians, whether it's nurses, paramedic forces, all the administrators and the enablers, we are all here to complement each other, not to compete with each other. That is very, very important to understand. And we all here have a shared purpose to make an impact, not only just to share spaces. That's very, very important. And that's important to build an organizational culture where every stakeholder and key element of the organization works towards this shared vision. The second is about creating a culture of resilience and create a culture where psychological safety is assured to all the stakeholders in the system. I'm sure all of you will agree that in a high-stake environment there are going to be challenges, there are going to be good days, there are going to be bad days, we are going to hit our crest and drop. But it's important to foster a culture of active listening and where differences are respected by the different stakeholders. It's very, very important. Organizations build a culture where we agree to disagree. That's very important, and that will give all the elements, all the key talent elements in the organization a very, very safe psychological space to voice our concerns and understand that even though there is disagreement, at the end of it, we're all working for the same cause and purpose. The third is, of course, having interprofessional trainings and shared learning objectives, which brings all the key stakeholders of the organization together. I know many of the organizations have standalone learning development initiatives. We have got clinicians separately, paramedics separately, and nurses as a cohort. But yes, looking at the larger organization targets and goals, it is imperative to understand that we have shared visions, shared purpose, and working at larger projects which have a bigger impact in the organization that brings all the key stakeholders working towards a common objective. The next is, of course, technology. I think the importance of technology cannot be undermined with AI, generative AI. We are talking of a lot of AI agents today taking care of all the repetitive and automatic work tasks that happen in the organization. So it's important for the organization to leverage on technology skills to have shared communication and collaborations across platforms where you share information, leadership dashboards, communication apps, shared medical information records, which has access and visibility to all the key stakeholders to understand that there is seamless flow of information and there is no misunderstanding or dissemination of information that leads to misunderstanding and I would say safety outcomes that gets compromised. Next is about the culture of the organization. As we said, the power of we. It is all about compounding and amplifying and celebrating team and collective successes. As Madam rightly pointed out, individual brilliance is good, but there are times when we are working for larger basic cause and objectives. is important to celebrate team successes. So it's very, very important that organizations have integrated talent practices. For example, if I'm talking of regarding team brilliance, organization as a whole should have policies that promote team brilliance, that recognizes brilliance achieved by multidisciplinary teams who come together and achieve larger organizational success. And the most important of all is to build a culture. The culture is always top down. It flows and how the leaders think, behave. The three important elements when we look at leadership in an organization: one is knowing, which relates to competency; one is doing, which is the KPIs; one is being, which is the most important component, is self-awareness. So it's very, very important to have self-awareness leaders who talk about and display empathy, who talk about celebrated successes, who talk about collaboration, not just talk, they walk the talk. So very, very important to have the successful reviews, the talent progression, identify the right set of leaders with the mindset to celebrate collaboration and share successes, and take this shared vision and purpose as one of the common organizational objectives and lead individual variances and silos. I think, madam, those are some of the important pointers that will help organization come together and compound the power of unity.
Yes, sir. Thank you, Dr. Durga. Now, fostering is very specifically mentioned, like fostering interdisciplinary team meeting, shared decision making, and integrated care pathways can significantly enhance collaboration. Emphasizing mutual respect and clear communication protocol help build trust among healthcare professionals.
Thanks for that. We're talking about the power of being and collaboration and the changes and opportunities. Could you discuss the importance of patient-centered care and how collaborative care models can help patients take a more active role in their care? If you look at it, actually, first of all, you should be good in your profession, and that's why you should be strong. And so if you are strong in patient care, then you earn your reputation. Patient-centered care ensures that treatment aligns with individual values, needs, and preferences, leading to better outcomes and satisfaction. So that's the patient experience we call it. Collaborative care models empower patients through shared decision making. So please come and talk.
Now, before we go into collaborative care or patient-centered care, let us take a step behind to understand the story or the genesis of this entire concept. Traditionally, patient care was called as a medical care model. The model that existed was the medical care model. And a lot of cross-sectional studies and literatures shows the shortcomings of those models. What used to happen in the model is there was a continuum of care from curing to caring. Curing was predominantly physicians' profile, where you look at the patient, diagnose condition, treat the patient, and caring done by the nursing team and the rest of the ancillary staffs in the hospital. Over a period of time, this continuum had only this phase of curing, and the caring aspect started slowly diminishing. Studies shows that our important stakeholders, which is our patients and their relatives, were extremely unhappy with this model for various reasons. Some of them told that communication from the healthcare staff was limited. They couldn't spend too much of time with the patients. They were focused only on the disease condition, but what came along with the disease condition was not their concern. They found the healthcare system very complex. They found it very difficult to navigate the healthcare system. Patients who had chronic illness found it difficult to continue with their treatment because when they had issues, when they had problems, they were not sure who to approach. Overall, there was a lot of dissatisfaction among the patients, and this really built up the case for having collaborative care and patient-centered care. When we talk about collaborative care, as spoken by the previous leaders sitting here, collaborative care is a team-based approach where you have everybody involved in the patient care actively participating in the care of the patient. It includes the physicians, the nurses, the pharmacists, the physiotherapists, the social workers, all of them equally taking care of the patient. Patient is very comfortable and it becomes a very patient-centric care where you are empowering patients, giving them information so that they are able to take adequate and right decisions. This patient-centric care also believes that each patient needs to be treated with utmost respect, dignity and compassion. Some of the advantages of having a patient-centric model or collaborative care model is, one is of course enhanced patient satisfaction. Patients are very happy with the care. Now this directly affects the patient outcomes. Many studies say that when a patient is happy with care, the clinical outcomes are also better. The family members are involved. The other advantage is that when you keep patients informed, when you keep patients educated, they feel empowered to take decisions. There is a shared decision making which happens, and overall the patient is very happy. Patient is happy, goes around and talks to other patients about the services given in the hospital, which means you get more patients into the hospital. The hospital in turn is able to churn out more work because the hospital is known as a more patient-centric or a more patient-friendly hospital.
Yes, Elizabeth. Dr. Elizabeth, you have very clearly emphasized that collaborative care models empower patients through shared decision making, coordinated support, and active participation in their healthcare. Let me ask one more question to you. Could you explore the role of innovation and partnership in improving healthcare delivery, including public-private partnership, innovation incubators, and collaborative research initiatives?
So the story of innovation is very interesting, and if I may say so, innovation is as old as human beings. Because if you look at the way things are evolving from the Stone Age man to digital transformation which is happening today, the buzzword is innovation. We've gone through various phases. We've had the agricultural phase, we've had the phase of renaissance, we've had the phase of the technology, and all this what comes across very clearly is curiosity, it is ambition, and it is hard work of human beings which is focusing on innovation to make this place a lot better. Now, when we talk about innovation, it's not different in healthcare industry. If we look at our practices, where we had our humble beginnings from herbal medications to what we are today using AI technology for diagnostics and as well as for therapeutic purposes, I think healthcare has also grown in leaps and bounds. Is this possible only for the healthcare industry to do this? No. The answer is having collaboration again, coming back to what the team strongly is standing for now, the power of we. Collaboration with government agencies, collaboration with private agencies, collaboration with pharmaceutical companies, with IT industry, because healthcare is extremely complex and it becomes difficult only for the healthcare to manage this. Now when you work in collaboration, there are various advantages. What are some of the advantages? It helps to leverage diverse expertise, because you have a pool of people sitting from various sectors, each of them bringing their own strengths to the table so that they are able to add value to the business that is being considered. Access to funding becomes very easy in a collaborative model. When there's public-private partnership, access to funding is much easy. Scalability of work is easy, and there's a lot of visibility to this. And overall, it improves patient outcomes. There's a lot of research funding which happens from various agencies which promotes research activities. Now, how do people get into this? The answer is through innovation incubators. What are innovation incubators? It's nothing but a program or an organization which helps to drive this sort of a partnership model. The advantages of what are the activities that innovation incubators does? So it helps to set up the infrastructure. It will help to set up anything related to business, starting from the legalities of the business. It could be clearing of paperwork. It could be bringing in expertise. It also helps in mentorship of business. This could, the innovation incubators could be virtual, or they could be actually there to help you out. They sometimes are there in the beginning of the venture and slowly phase out as they feel that the institution or the organization is self-funded. So when we talk about innovation, through innovation incubators, there's a lot of activities that can be done, especially in the field of research. It be it in the form of adding new research molecule, it could be medical devices, it could be any formulation which adds value to the patient care. So all in all, yes, innovation is the key for progress, and public-private partnerships are something that we have to look into, and the aid that is available for these sort of activity is innovation incubators.
Yes, Elizabeth, very clearly you have explained. And my last question to Mr. Durga, could you discuss the importance of workforce development and how education and training program can support the development of a collaborative workforce?
Madam, this question relates us back to the foundational elements of workforce development and skill. I think it's very, very important for organizations to understand this will begin with the end in mind. This is where most of the organizations go wrong. They don't explicitly define what skills and competencies they are going to build over the period of 3 to 5 year horizon. So I think it becomes all the more important to define what are the competencies, what are the skill sets. Again, when you look at competencies, what is the organization going to bring on core competencies, functional competencies, leadership competencies, and behavioral competencies. So once you have that alignment in terms of the kind of skill sets you are going to build for the progressive organization in the short term and the long term horizon view, it's going to make things very, very easy. And coming to the collaboration in terms of the workforce development, I think today the whole objective remains the same, but with advent of time, the practices and the approaches to skill building in organizations are largely changed. Today, organizations are leveraging the power of technology in terms of gamified learning, which is bringing all the key stakeholders of the healthcare ecosystem together. That excites the new generation of nurses, clinicians, all the right and support forces who come together and learn for the same cause. We have simulation and role play-based trainings where we actually emulate the situation, the behavior in hand that brings together all the key talent forces who interplay and complement and supplement each other in terms of learning in the same group. And again, we have a lot of added overlaps in terms of competencies today. We are looking at clinicians who want to learn more about center of excellences, who want to learn about cost centers, who want to build a center of excellence and look at their own elements as center of excellence generating and making business sense. We have nurses who want to move to career trajectory to management and so gone are those days when you had conventional, one-dimensional client ladder where promotions and career progressions were happening by virtue of time and experience. Today it's an open market. Today a lot of organizations are encouraging the different cohorts of talent to change tracks, adapt new technologies, build competencies, and today skill is the new competency in organizations. Today, going forward in the future also, what will define the workforce for the future is only going to be skills. And the skills will define what kind of roles and what kind of movements in terms of career maps, career indices, and the different dimensions organizations offer. So very, very important to have the right competencies in matters defined in organizations, and with all the interesting and all the different elements of learning methods available today with organizations, anytime, anywhere, any device learning. It gives the independence of bite-sized learning to all the key stakeholders, and with that I'm sure the organization can leverage and compound the power of which we are giving up shortly now.
Yes, Mr. Durga, you have well narrated that a well-trained collaborative workforce is crucial for delivering safe, efficient and patient-centered care. Ongoing education and interdisciplinary training programs with teamwork, communication skill, and shared understanding among the healthcare professionals. Over to Dr. Sautila.
All right, we spoke a lot over here, and so you should take home some messages. So the power of the most important power you have today is that there is no other profession where there is any, let me rephrase it. There is no profession like nursing profession where there is any unemployment, no unemployment at all in nursing. So that's the biggest power. So I always tell, I think my principal is here, Susan and Lina and all the nursing leaders are here. And I always say that, when I started the nursing college, I used to tell the parents that all the people in the nursing college will be absorbed in our hospital. Today, I go and tell them, I'm requesting them, please join all the people passing in from my nursing college, join my hospital. So that's the power you have. So utilize it. So how do you utilize it? And that's what Mr. Durga and Dr. Elizabeth were alluding to, and Grace what I was professionally explaining. So how do you do that? You command respect. I always tell them, don't demand it. And how do you command respect? And because of your competencies. What is your competency? First, patient care. Everybody spoke about it. Second, technology know-how. Make techno-savvy. And third, innovation. Always try to improve your work in a better way than you were doing yesterday. And fourth, you don't demand, but you express your views and in a very good manner in any committee or anywhere. And the most important thing for that is learning and development. So that's the fourth thing, learning and development. It gives you communication, it gives you all the other skills. So remember these four things which you take home. And all the nurses, today you are in demand. 30% attrition and 3 million nurses in India. You are a power of the. Utilize your opportunities and let us make changes, and we will work together for that. Thank you. Thank you.